So I'm looking forward to talking to you about navigating the advocacy path, supporting an adult with specific healthcare needs. And I did want to note that a lot of the information we'll discuss today could apply to people of all ages also, and not just adults. So we'll go ahead and move on to the next slide. I'll tell you just a little bit about myself. My name's Faye Alexander. I'm the Operations, Compliance, and Contracts Coordinator at the Coordinating Center. I've been here for about 8 years now, so although I'm in an admin role now, I have previously worked in client-facing roles, and some of those roles included being a health coach, a team manager, and a certified community health worker. I've worked with individuals who have specific healthcare needs. I've worked with both youth and young adults and children with specific healthcare needs, and of course their families. And then I've also worked with seniors. So through those different roles, I've really become passionate about advocacy in particular, and really coming alongside the individual clients and their families and encouraging them in their advocacy um, process. So anyhow, that's what I'm here to talk to you about today. Again, thank you for joining, and we can go ahead and move on to the next slide, which I just want to set a few ground rules and have a few asks for you today. This I did want to mention again. I know Heidi mentioned it earlier, but in case you weren't logged in yet, this presentation will be recorded. The question and answer session will not be recorded, though. We do ask that everybody remain on mute during the actual presentation. We are going to ask, if you want to, you can put comments or questions or thoughts into chat, and then we'll address them during the Q&A. And so Heidi is going to be monitoring that chat for me. The other piece I wanted to ask was that we really keep this a safe space and not offer judgment towards others. So if somebody shares personal information, either in the chat or during the Q&A, we ask that you would keep that to yourself and keep this within this group. So anyhow, the slides and any related documents will be emailed. And then if there's any questions that I'm not able to answer, or if we don't have time to get to them, then we'll go ahead and email those out to you also. So the next slide, please, Heidi. So I did want to just mention this disclaimer. This is intended for informational purposes only, so it's not meant for professional advice. Right, and we'll take a look at the agenda just briefly. So we are going to open up with a question, and Heidi's going to pull up a poll in a minute that you can all put in your answers to that if you would like. And then we'll start talking about advocacy. And so what we're going to cover is the importance of advocacy, really navigating that advocacy path, and then resources and tools. And then we'll end with the questions and open discussion. And again, that questions and open discussion part will not be recorded. So today I'm hoping you will get from this presentation, you'll be able to walk away with really a good understanding of why it's important to advocate, while also thinking about developing a vision for your loved one's future, and then also being able to incorporate your loved one's priorities for themselves into that vision also. And finally, I'd like you to be able to walk away with a few tangible resources and tools that you can utilize. All right, so we're going to go ahead and get into the question now. So taking a look at the question or the pictures on the slide, where would you say you are in your journey as an in your advocacy journey as a caregiver? Would you say it's like number one, where it's like a maze and you just have to find your way around? Would you say it's more like number two, where it's pretty clear and the road's smoothed and paved ahead? Or would you say number three, it's pretty foggy? Or is it like number four, where it's like, okay, I don't even see a path? Or is it more like number 5, where you have the tools that you need to navigate the path? So go ahead and submit your answers, and then we can take a look at those results in real time, I believe, right, Heidi?
It should be in chat. I have about 6 people have answered so far. Some people are answering directly in the chat, which is great.
Yep, that's fine too.
I'll give a few more moments and then I'll end the poll. Okay. And I'm going to end the poll now. All right. Faye, are you able to see the results?
Yes, yeah, I can see the results. Thank you. So, yeah, it looks like people are fairly spread out with a little bit more people saying that they have the tools to navigate the path. And so that's excellent. That's where we would hope everybody will end up, not necessarily by the end of this presentation, but just as they learn more about advocacy, where they feel like they would be on their advocacy journey. And I did want to note that this could change. You could answer differently at different points in your journey. Right, so we'll go ahead and move on to the next slide, please, Heidi. So I did want to mention before we dive into advocacy is that you may hear me use the term family, or you could hear me use the term loved one. I've already been using that term. So I did want to note that family can look different for each one of us. It could be a chosen family, the family you're born into. It can also be, although I'm going to be talking about adult loved ones, you may also utilize some of this information when working with clients if you're in a professional role where you're advocating for clients. So there's did want to just make a note of that. So we'll go ahead and move on now. So let's talk about why advocacy is important. Uh, so it really at times may feel like you're up against a mountain when you're advocating for your loved one's needs. So I'd encourage you to just keep moving forward. Communication is really key in the process. So communicating about your loved one's needs and also any goals that they may have for themselves. And then ultimately, we want the outcome to be that our advocacy is resulting in an improved quality of life and outcomes for our loved ones. So I think it's important to remember the why as we're on our advocacy journey. Uh, so just keep that in mind. So let's move on to the next slide now, please. So I did want to talk a little bit about advocacy and give you the specific definition. So I'm going to read this directly. Advocacy means to speak in support of something or someone. And an advocate is someone who pleads the cause of another person or someone who stands up for that person's needs. So I'd just like to start off with a reminder of the definition of advocacy and what it means to be an advocate. So as a loved one of an adult with special health care needs, you're probably learning about advocacy very quickly rather, and learning how important it is. So really in the life of an individual with specific healthcare needs, advocacy really is a needed skill that's required to ensure that your loved one's needs are being met. Now, I did want to note that today we're talking about individual advocacy. There is advocacy at the systems level, and so it could be advocacy through advocating through your delegate or legislator, whether that's at the state or the federal level. It can be joining an advocacy group so that you have a group to advocate with. So I did want to mention that also in relation to advocacy, although again, that's not the focus of today's discussion. So I'd like you to take a minute to think about how comfortable you are with advocacy. So on a scale of 1 to 10, with 1 being not comfortable at all and 10 being very comfortable, where would you say you are with your comfort level with advocacy? And then you can put that in the chat if you want to, or you can just make note of it. So great, I see some 8s, that is amazing. A 5, great. 4, excellent. Thank you all for sharing. We got a 6. Another 6, it looks like. So yeah, it looks like you all are pretty comfortable in your advocacy, or at least have some level of comfort. And it is a journey, so we just have to give ourselves grace as we're learning this process and going through it. So we can go on to the next slide. So now the first thing I want you to think about is if I were to give you a blank canvas and some crayons or markers or paint and asked you to paint of the vision for your adult loved one's future, what would that look like? So take a minute to just imagine that. Feel free to put things in the chat if you want to. You don't have to, though. You can also jot notes to yourself down. So what might be colored scrambled eggs? I love it. What might be some things that are part of your vision? So we have some food, we have potentially transportation to get to appointments. It could be a vision of your loved one doing something they enjoy, whether that's spending time with people, laughing along with their favorite movie, doing a puzzle, sitting on the beach. Can look different for each one, right? Ease in living without worries of getting done by themselves. Excellent. And then as we think about our vision for our loved one, what are their goals and their desires and their priorities for their own future? I think it's important that we incorporate those into the vision that we have. And is that something that you're aware of? If I were to ask you to answer that question right now, would you be able to give that answer, or is that something that you need to have a conversation with your loved one about? And then looking back on your advocacy journey, what barriers have you run into, and then what successes have you experienced? And I think it's really important to remember where we've been and what we've accomplished as we're looking forward to the future too, because then as we think about any barriers and successes that we've had, it helps us to really realize what tools we may already have to utilize and to build up our confidence in the advocacy journey. And then finally, what scares you and excites you related to your adult loved one's future? I think it's important to be aware of those things. And then are there things that we can do um, to really, if it's something that scares us, is it something that needs to be addressed? Do we need to have a plan in place? And I see some people answering now in the chat. Thank you. So elderly parents reluctant to write a formal will. And we will talk a little bit about legal resources, although again, it's not going to be the focus of this presentation, but we will bring that up later. Trying to do too much on their own, even when there's help accessible, it looks like. Right, great. We'll go ahead and go on to the next slide. So this is really the advocacy path that we're going to go through today. So we're going to look at learn and then work our way through to self-care. And we will break each one of those down. So I really encourage you as we go through each step in the process that you consider how you'll encourage your loved one in their autonomy and to be able to advocate for themselves also. Right. So we'll kick it off with learning. So you can share in the chat or just jot a note to yourself, whichever you prefer. What do you need to learn or want to learn about your loved one's needs? So how would you answer that question? Some of the things you may want to learn about or need to learn about could be different things related to your loved one's diagnosis. So it could be learning about the signs and symptoms that a diagnosis may be getting worse. It could be that's also referred to as red flags. It could be learning how to respond to those red flags, whether it's a call to the doctors or you know, whatever guidance the doctor provides about those red flags. And then the other thing is it could be learning about what needs your loved ones have. Maybe right now you're not even aware exactly what they need, and that's okay too. Everybody starts at some place on their advocacy journey, right? And so as you're learning about different things, I'd encourage you to keep record of the different conversations you have, different appointments that your loved one has, notifications from insurance, different medical bills, that sort of thing. And find a way to keep it organized and in one place. So for some people, that could be a filing cabinet with different file folders for each topic. It could be a binder or multiple binders if you've been doing this for years. It could also be electronic. So just I'd encourage you to have a backup for whatever system you're going to be using though. And then the other thing is to really be open to learning new things along the way. You may already be well aware of your loved one's diagnosis and what their needs are, but as they age and possibly new diagnoses may develop, new needs may arise. So it's really, the learning step is really a process, an ongoing process. So again, I'd encourage you to just make note for yourself what you want to learn in the process. And then also you can think about what your loved one may want to learn also. So the next step is to really ask questions. So one way we learn, right, is by having conversation with people and asking questions. So whether it's to medical providers or community resource providers, or possibly even other caregivers and family members who are going through a similar experience. We can learn from each of those individuals and get some of our questions answered. And then keep in mind too that you can ask about different resources, and asking about financial eligibility for those resources is important. And looking for no-cost services too, to see what's out there in way of no-cost services. And then asking others where to get the best care. Other caregivers and individuals may be able to provide you feedback about their experience with the provider. And so you can learn from other individuals about that. And so just another point to think on, thinking back to your vision of your loved one and their future, what questions do you want to need to ask? And then I'd encourage you to start to write those questions down and figure out who will be able to answer those questions. Is it the primary care provider or specialist or possibly a mental health therapist? So if you begin to form that list, you could actually take that with you to doctor's appointments and whatnot. And the other thing is, I would encourage you to talk to your loved one to find out what questions they may have too. So we'll go ahead and move on to the next step, which is connecting. So again, feel free to put this in the chat if you want to, or just jot a note for yourself. But some questions to consider is what connections are meaningful to your loved one? What individuals do they already have in their life that either already offer support or could possibly offer support? And I just want to note too that really providing support can look different and can be offered in different ways, whether that's support of friendship and taking the time to listen, or it could be providing transportation to get to medical appointments or bringing your loved one a meal. And then the next question, who in your life may be someone that can serve as a backup caregiver? Do you have a trusted individual that would be willing and capable of serving as a backup caregiver? So those are all things you can begin to think about when you're thinking about who you can connect with. I would encourage you that if there is someone in your life that could serve as a backup caregiver and they're able and willing to, that you talk to them about really beginning to train them or mentor them so that they could take over in the event that you need a break or some assistance. So, and just a reminder, really building connections is key to being able to learn from other individuals, and also keep in mind that you'll be able to share your knowledge and your experience with individuals too, and others may benefit from the things that you know and from experiences you have had. So really building that network and that village can offer you that support you may need as you're on this journey, so you don't feel like you're on it alone. All right, we'll go to the next slide, so this one talks about becoming an expert. So along with the learning and asking and connecting to others, I'd encourage you to really continue to build your knowledge and become an expert. And what I mean by that is not that you need to be an expert in everything, right? But one area that I would encourage you to really get to familiarize yourself with and become an expert in is your loved one's health insurance plans. And the reason for that is then you'll know what benefits are covered. You'll know how to navigate the health care system. You'll also, I'd encourage you to review the material and information that is provided. And I say that, and I don't always do that myself. So every time I talk about this point, I'm like, okay, I need to dig in a little bit more and read the material that's sent to me too. And then also utilize the insurance company website. So gather any questions you might have about the health insurance. If you're not able to find it in the materials or on the website, you can always call the health insurance company to get those questions answered. And so I know a lot of people who may be newer on their caregiving journey. This is an area that some people struggle with because they're not comfortable and not confident in really navigating the health insurance system. And so by learning, you're equipping yourself with more information, and then you'll start to feel more confident and able to speak up. And really, by having that knowledge of what your loved one is eligible for, then you'll be able to advocate for services for them. Right, and let's go on to building partnerships. So with building partnerships, this one is really looking at coming alongside and working with individuals in your loved one's life who have the knowledge and the experience, the expertise to help you in your advocacy journey. So whether it is medical providers, primary care providers, specialty care providers, or community resource providers, each of those individuals will have knowledge of an expertise in a certain area and can help you in the advocacy effort. So it could be a medical provider who writes a letter of support or provides a script to get a medical equipment or something like that. So they can play a key role in this process. And as you're working with individuals, one of the keys to really building that partnership is really advocating with kindness and understanding, and then a willingness to hear both sides of the issue too. All right, we'll go ahead and move on to the next one. And actually, before Heidi, can you go back one slide, please? So did want to take a minute, and again, you can put this in the chat or just jot it down and make note for yourself. But what roles in your loved one's life are there currently that could potentially that you could partner with on this journey? Could it be the pharmacist, or could it be a specialty care provider? Feel free to put that into the chat, but we can go back to the next slide, Heidi. Thank you. So now with self-advocacy, so I wanted to talk about this in two ways. The first one being when you're advocating for yourself versus advocating for your loved one and promoting their self-advocacy skills. So for your loved one, as you're advocating for themselves, I'd encourage you to also help build their advocacy skills and really to allow them to speak up for their own needs at times, give them space to talk to the doctor or the provider so that they can share their concerns and their questions. And it really is a balancing act because we want to make sure our loved ones' needs are being met, but we want to give them the ability to be able to speak up for themselves also as much as they possibly can. And so some individuals, especially if they're new and speaking up about their own needs, one thing that might help them is to sit down with them ahead of an appointment and talk to them about what they want to share with their doctor, what questions they may have for their doctor, and get them to list those out, and bring that list to the doctor's appointment so that they can use that or share that with the doctor. And then that can help make sure that their needs are getting met and being addressed, and that their voice isn't lost in the process. That's also a great technique for any of us to do for ourselves in our own advocacy is when we are going into appointments to write down the things we want to talk to our providers about. So along the way, going back to those previous steps in the advocacy process of learning, asking, connecting, building partnerships, how can how can you encourage your loved one to be part of that process? It's something I'd really like you to think about and really look at what their strengths are, what they're already able to do for themselves, and that sort of thing. And then it really just encouraging them through that process. Uh, so I did want to note too that it can sometimes when we're supporting other individuals, our own needs can get lost. So a question I'll pose to you, and this is not at all in judgment. So, but just if if you don't want to share in the chat, you don't have to, but just think about, have you neglected yourself in your advocacy for others? So I'm just gonna pause there to let that kind of sink in and you guys can think about it. Absolutely, yes. Yeah, I love it. Lots of exclamation points after that. Thank you for sharing. Um, yes, so I'll go ahead and repeat the question. Have you neglected yourself in your advocacy for others? And again, that is not asked in judgment. That is asked for all of us to reflect on that and see where maybe we need to make sure. Excellent. You have not good, good. Uh, so the so yes, some people maybe making sure their needs are met, other people may be getting lost. Unfortunately, it has happened. Yeah, sometimes we might be really on top of things for ourselves as well as our loved ones, and then we might end up getting focused just on our loved ones' needs and neglecting our own needs. So yes, it certainly can happen. I don't think it's uncommon by any means. And the reason I bring it up is to just to encourage you all to make sure that you are um, having your own needs met. And so giving yourself time to go to your own medical appointments and really be able to speak up for what your needs are is just as important. And again, it goes back to that um, when you're flying, the mask analogy on the airlines to put your mask on before you help somebody else. So um, just keep that in mind. And we're going to talk a little bit about self-care. So we can go ahead and move on to the next slide. All right, so self-care. All right, another question for you, and feel free to put this one in the chat too. Who at some point in their lives has viewed self-care as a luxury? So I know I certainly have at points in my life felt like, man, there is just not time. Um, Great. Somebody said they view self-care as a priority. That is excellent. I'm so glad you're already there. Uh, I might have missed some of the other comments coming up. But yes, it really, I think this is one of those areas where some of us, and I speak for myself in this situation, where I've really had to learn to reframe my thinking on self-care, and instead of thinking of it like a luxury, thinking of it as a necessity. And it truly is something that we all need to be doing for ourselves, and it can look different for each one of us, but it's really finding something that fills your cup and refreshes you so that you can continue to be your best self and, bring your best self to your caregiving role in the other parts of your life. So again, advocating for yourself is crucial. As well as advocating for your adult loved one. Yeah, somebody said I need to start thinking of self-care as a necessity. Yeah, yes, yes, please start to reframe your thinking on that. So, and the other part of self-care, and you can kind of see on this image here, there's different aspects of self-care, right? There's like physical, emotional, social, spiritual. So but yeah, setting some time aside to ensure that you're taking care of yourself is key. And it can be just something as simple as 5 minutes. If that's all you have, just taking 5 minutes to do some deep breathing. Again, it's going to look different for each one of us as to what we need and what is really going to fill our cup. The other thing I'd encourage you to do is, I'd mentioned when we talked about building connections, I mentioned about if there's any trusted individuals in your life who may be able and willing to serve as a backup for you in the caregiver role. And so finding, mentoring them along the way and helping build their skills as a caregiver, I think is gonna it's gonna make it a lot easier and things to go a lot more smoothly when you um, do ask them for help because they're going to be prepared. So, and don't be afraid to speak up and ask for help because sometimes people may think we have it all together when it's like, man, I could really use a break. And I, you might not feel like you have it together at all. So don't be afraid to speak up and ask for help, and then be specific in your help too, because sometimes people are more than willing to help. They're just not sure how to help. So if you get specific about it, then people will know more how they can help and maybe more willing or able to. And then I think the other piece that can be hard for a lot of us is to be willing to say yes to help when it comes along. So just some things to think about. I always kind of feel like I'm lecturing when it comes to self-care, so I hope that didn't come off as a lecture. Uh, Again, I think the most important thing is really just finding what is going to fill your cup and just starting, if you're not already there, starting to reframe your thinking as like, okay, yes, I need to do some self-care once in a while, rather than thinking of it as a luxury. All right, we are going to go ahead and talk about some resources and tools. And so, um, a while ago, I mentioned we were going to talk about some legal resources. Again, this isn't a legal presentation by any means. I do not have that expertise. So, but I did want to share some different resources. And I believe there is a previous community enrichment um, recording webinar that you can access on our website that does talk about legal resources in depth. So, and Heidi, I know you mentioned just now in the chat that the presentation and resources will be emailed to them. Could we include the link for the community enrichment already done? Okay, good. Got the thumbs up. So I'm not going to delve into too much detail on any of these, but has anyone utilized any of these services or resources that are on listed here on the legal documents? Or do you have any other legal related resources that are your go-to? So, nope, okay. Yeah, and so these are good resources to start, the ones on the slide. So direct your attention to Maryland Legal Aid. They are available throughout the state of Maryland. And so you could contact them to see if, you know, you do have a legal question or a situation where you may need to get a lawyer involved. You can contact them to see if it's something that they can assist with. The other piece is Disability Rights Maryland. They have legal experts who can come alongside you in your advocacy efforts too. So if you're ever running into any issues with advocating and getting some of your loved ones' needs met, you may want to reach out to Disability Rights Maryland to see if that is something that can be that they could help you with. The other piece is I had linked in here some estate planning articles. That's about midway down on this list. So you can check that out too. And then we'll go ahead and move on to the resources on the next page.
And Faye, you've utilized disability rights previously, correct?
Yes, I have worked with individuals and connected them to Disability Rights Maryland, and they've been able to help in some situations. Yep, and Maryland Legal Aid, I referred people to quite often. Particularly, I mean, um, there's no cost for their services, so you know, for a lot of people, budget is a concern, and legal services can be very expensive. So those two organizations, cost is not a concern. So anyhow, yes, the resources and tools on this page, again, these are also linked so you can see the words in green that are underlined, and same with the legal resources page. You can click on those links when Heidi gets those sent out to you, and you'll be able to read more about each of these. So I did want to just mention Got Transition website that that has some transition readiness assessment forms that breaks down different things to manage your own health care. And so although this is really geared for youth and young adults transitioning into adulthood, it still may be a good tool to utilize to see where your loved one is at in terms of what they can do with managing their own health. Whether it's one of the questions is, are they able to seek emergency help, or, and these are not verbatim, by the way, I don't have it memorized, but if they can manage their own medications, that sort of thing. And so does anybody have any, I'd like to stop now and we can start the question and answer section and just have a discussion too. But does anybody have go-to resources that they like to utilize?